Hey, do you know that your body's just a big hydraulic system? If you got too much blood pressure, what happens is you blow a valve or you blow a hose. If you don't have enough, you can't run the equipment, and your heart and your blood pressure is no different. So we put together a video presentation on high blood pressure, low blood pressure, and the natural things that you can do about it. Here it is. Hey, what we're going to talk about is blood pressure, natural treatments, what is high and low blood pressure, what are the symptoms of high blood pressure, hypertension, or low blood pressure, and what are some natural ways to reduce blood pressure. Now, after watching the video, you should understand about your blood pressure parameters, why it's so important, what it means to your overall health, and then some natural ways to treat blood pressure, both high and low. High blood pressure is the main risk factor for stroke and for cardiovascular conditions. And there's also increasing evidence that it's a risk factor for vascular dementia, or basically losing your memory factors in your brain. Now, high blood pressure is when your levels are consistently above 140/90, and about 16 million people in the United States have high blood pressure. 30% of the women and about 32% of men have this problem. And up to age 64, there are higher rates of men with high blood pressure than women. People with high blood pressure are 3 times more likely to develop heart disease and stroke, and twice as likely to die from these as people with normal blood pressure. And there's about 62,000 unnecessary deaths from stroke and heart attacks due to poor blood pressure control. High blood pressure rarely has any symptoms. It's the silent killer. The only way for people to know if they have a condition is to have their blood pressure measured, and approximately 1/3 of the people with high blood pressure don't even know that they have it. And more than 90% of people with high blood pressure who are receiving treatment are not controlled. It's above 140/90. Now, when you take your blood pressure, it's really important to do it in 2 ways. You take your blood pressure lying down, it should be 120/80. When you stand up, your blood pressure should go up so that the blood doesn't run out of your head. They call this Raglans Test. So your blood pressure lying down 120/80. Optimally, when your blood pressure you stand up, it should be 126/86. Your pulse rate should stay the same. We actually have a video about Raglans Test and why it's so important. Now, most people with high blood pressure may need to take a medication or a natural program to reduce your blood pressure. The risk increase as blood pressure rises. Whether you have high blood pressure or a normal blood pressure between the ages of 40 and 70, for every rise of 20 millimeters of mercury systolic or 10 millimeters of mercury diastolic, the risk of heart disease and stroke doubles, for the range of 115 to 75 up to 185/115. Common prescriptions for blood pressure are lisinopril, amlodipine, losartan, Benicar. There's a lot of them, just to name a few. Some of the side effects to the prescriptive medications for low blood pressure are anemia, constipation, dizziness, lightheadedness, or weakness, especially when standing up suddenly or getting up in the morning. It can cause drowsiness, dry mouth, erectile dysfunction problems, and fever. So here's a couple natural considerations to manage blood pressure. And at the end, we also want to talk about low blood pressure, because in my experience, low blood pressure is a little bit harder to treat than high blood pressure. So the ways to help with your blood pressure is to get your body on a schedule, to eat healthy, to move and exercise, to manage your metabolism, balance your hormones, and then some natural over-the-counter things is vitamin D3 really helps, approximately 5,000 units. And if you live in a winter wonderland, you may need to do 10,000 units through the winter time, but you can manage this and check this with blood tests. Olive leaf is one of my very favorite herbs. It also has an amazing immune system component for blood pressure. My favorite mineral is magnesium, and if magnesium gives you some bowel looseness, which sometimes it does with people, you can use topical Magnesium cream, liver support, through Nature's NX, through Filter Flush. Omega-3 is about 6,000 to 8,000 milligrams per day is really, really helpful. And essential fatty acids, about 6,000 to 8,000 milligrams, really helps for the maintenance of cardiovascular conditions and blood pressure. Now, with low blood pressure treatments, it's really important to make sure that your neuromusculoskeletal health is good. Neural means nerves, muscular means muscles, skeletal means bones. So your muscle movement, nervous system is really important for low blood pressure, and you want to increase your protein levels and specifically your heart health. Hawthorne works really well for that, and my favorite is a protein morphogen therapy called cardiotrophin. Cardiotrophin means heart, trophin means builder, really helps to rebuild the heart. Hey, thanks for watching the video on the natural treatments for low blood pressure and high blood pressure. Our goal and our mission is to help people so that they may achieve and maintain optimal health. If you perceive value, please like our video. Remember, we're always across all platforms, on podcasts, on articles and videos. This is Dr. Jason West, and we'll see you tomorrow.